USAID Center for Education in Washington. And I'd like to ask my colleague, Rebecca Pagel, to come off mute if you'd like to and introduce yourself.
Hi, everybody. I'm Rebecca Pagel. I'm a Senior Monitoring, Evaluation, and Learning Advisor in the Center for Education with LEA. It's great to be here with you all today.
Great. Thanks, Rebecca. So Rebecca and I have been working about a year and a half ago. We started working with our colleagues from the Data and Evidence for Education Programs activity, the DEEP activity, to understand the landscape of disability measurement and education programming, and wanting to really understand what does it mean for the work that we do in inclusive education for learners with disabilities across the education spectrum, from pre-primary all the way through higher education. And so that is what we want to talk with you today about. We're happy to be joined by one of our other DEEP colleagues today, Emma Venitis, who's producing this webinar. And so you'll see Emma in the chat box posting questions and prompts for everybody and helping us to keep the flow going. We're also very fortunate today to have Trifine Munganinga from USAID Rwanda and Laura Parrott from USAID Nepal joining us. And they'll be sharing their experiences collecting and using disability data in early grade reading programming and also in youth workforce development programming. Both of these missions, Rwanda and Nepal, have been doing really important work in this space. And so we're really looking forward to learning today from Trifine and Laura. We can advance to the next slide, please. So here is our agenda today. We're going to start out with a little introduction that provides a brief background on why disability data is important for our work and what it allows us to do in education programming. And then Rebecca will talk about kind of the nuts and bolts for how to actually collect disability data. And then we'll pivot to Trifine and Laura, who will share their experiences from Rwanda and Nepal. And then we'll come back to you all, and we want to really talk with you all about and understand from you the challenges that you may be facing in your countries around collecting and using disability disaggregated data, and also the opportunities that you see in this space. And so be thinking about those things throughout this presentation, because when we get to that part on challenges and opportunities, that's really where we want to open it up and hear from you all. Then, of course, we'll touch on new guidance, tools, and resources that are available and walk through those things. And then finally, we'll have open discussion and Q&A. We would love to know what you are hoping to learn and gain from today's webinar. And so I invite you now to go ahead and type that into the chat box. Anything that you're really hoping to learn, to gain, or to contribute to today's discussion, please put that in the chat box. Also, throughout the webinar, if there are any questions or comments that come to mind, please also feel free to put those in the chat box. We'll be keeping an eye out, and we'll answer as many as we can during the Q&A at the end of the session. Okay, we can advance to the next slide. In the next slide, we'd like to see the polling results. So when we were first starting out, I had mentioned that we have 2 polling questions. Let's go ahead and see the responses to those 2 questions. The first question is, does your country collect official data on learners with disabilities? And Emma, whenever you are able to post the results. And the second question is, does your missions education programming collect data on learners with disabilities? And let me see, maybe I'm the one who has to post them. Okay, here we go. So the results, thank you, Emma. The results are in the chat box. The results to the first question asking whether your countries collect official data on learners with disabilities. Of those who responded, 5 said yes, 1 said no, and 4 said not sure. Countries who are collecting data on learners with disabilities may make that data available in different places. I would love for those of you who said that your countries do collect data on learners with disabilities, if you can write in the chat, or if anybody wants to come off mute to share where is it that the country makes that data available, that would be great. If you're not sure whether your country collects official data, it's a great question to go back to your Ministry of Education to ask, right? where can I find data on learners with disabilities? So the second polling question asks, does your missions programming collect data on learners with disabilities? And from those who responded, it looks like 4 say yes, 2 say no, and 4 say not sure. So kind of similar to the first question, right? It's a little bit of a mix. We can go ahead and advance to the next slide. Great. So there is a lot of measurement work to do in this space. Measurement around the progress in achieving inclusive education, measurement to track outcomes for learners with disabilities, also work related to screening and identification of learners with disabilities. Disaggregating data by disability is a starting point, and that is what we are going to talk about today. So we can stay on that previous slide actually. Thank you. So just to talk a little bit about what does disability data allow us to do within our education programming? Well, data on persons with disabilities, as with any population or demographic, is essential for ensuring that policies and programs and budgets are responding to the population's needs. There's that saying, right? If you're not counted, you don't count. So it's really important to have this data on learners with disabilities. In the work that we do in education, this type of data is essential for many reasons. For example, it tells us who among our beneficiary group of learners may require additional support to access education, training, employment on an equitable basis. And it's that data that helps us to budget and to plan accordingly. Disability disaggregated data in education programming can also tell us who may be left out or missing from our programs. So for example, even if we hadn't been planning to have an inclusive education approach to our programming, but later we decide to collect this disaggregated data, if we find, for example, that a very small percentage of our beneficiaries are persons with disabilities, that can be a signal that our program may not be reaching as many learners with disabilities that are actually there in education settings. And then another example is that it allows us to measure education outcomes for learners with disabilities. So for example, collecting disability disaggregated data in our learning outcome indicators. Next slide, please. So just to kind of give you a little more color around what is the situation of learners with disabilities globally, and also kind of what is our footprint of our programming. So there are an estimated 93 to 150 million school-age children with disabilities worldwide. And we also know from global data that approximately 1 in 7 individuals are persons with disabilities. Yet, as some of you noted who responded to the polling questions, data on learners with disabilities either is limited, it's not always available. Even if it is available, it may not be reliable for a number of reasons, how it was collected, that sort of thing. But the good news is that that is changing, and more countries are collecting data on learners with disabilities. There are global efforts to improve disability data within education management information systems and other official databases. And there's also more work that is being done on screening and early identification of children with disabilities. But we aren't there yet. We don't yet have comprehensive and consistently available data on learners with disabilities. But we do have USAID programs that are working with learners, learners who, whether we know it or not, may have disabilities. And so we can be using that as an opportunity to generate data for use within our programs. So in fiscal year 2020, USAID supported 60 disability inclusive education activities in 29 countries across the world. And these activities span areas such as pre-primary education, primary, youth workforce development, higher education. And all of these activities present an opportunity for USAID to generate data on learners with disabilities. The picture that you see on the PowerPoint is a map of the world, and the countries that are shaded in dark gray are those where USAID has education programming in general. The countries that are shaded in the dark blue are those 29 countries across the world where USAID has disability inclusive education programming. And this is all information taken from the fiscal year 2020 PPR. Next slide, please. This is also information from the PPR. A greater number of USAID operating units are also reporting disability disaggregated data within the PPR, which is fantastic. So 23 of the 29 operating units, mostly missions, who reported disability inclusive education activities in the PPR also included disability disaggregated data in their reporting. And this is up from 9 operating units that reported disability disaggregated data in fiscal year 2019. So there's a good number of USAID missions who are working through their partners to collect this data. So I think we have a lot of lessons that we can be sharing with each other about how to go about this work. Next slide, please. So Rebecca is going to talk with you next about how we collect disability data in our education programming. But before I turn it over to her, I just want to share with you the framework that we use to understand and measure disability. So many of you are familiar with the social model versus the medical model of disability. And that's the first graphic that you see on the top right of that PowerPoint screen. The social model is the picture on the right-hand side. And we use the social model of disability, which says that disability is not the result of an impairment alone, but rather it results when a person with an impairment related to vision, hearing, mobility, etc., encounters an unaccommodating environment. And so it's that interaction of having an impairment and being in an environment where there are barriers that then result in disability. And so what are barriers? These are societal barriers that are socially constructed, such as inaccessible environments, physical environments, inaccessible materials, modes of communication that don't work for everybody, discriminatory policies or exclusionary policies and attitudes that limit individuals' agency, voice, and opportunity to participate. So it's really these things that lead to a person's disability or a person being disabled in society. And we use this social model framework because, well, for a couple of reasons. One, it supports the human rights of persons with disabilities. This is the framework of the Global Disability Rights Treaty, the United Nations. From a practical standpoint and for our programming, this model is also very useful because it helps us to identify barriers to participation that through our programming we can mitigate or remove. And it is also from this framework that the Washington Group questions on disability originate. The Washington Group questions, and that's the second picture that is on the PowerPoint. It has a light blue background. These questions are a set of questions that ask about the functional limitations that an individual may experience across 6 domains of daily living, including seeing, hearing, physical mobility, remembering or concentrating, self-care, and communicating. And the Washington Group questions were designed under the auspices of the UN Statistical Commission in the early 2000s to be used in national household surveys and censuses to identify disability prevalence and, importantly, to provide internationally comparable data. So as of 2021, the Washington Group questions have been used by over 75 countries to generate disability statistics. They are largely accepted by the international disability rights community. A lot of donors and partners are using these questions. It's also the measurement tool that is being used to disaggregate disability data in the Sustainable Development Goal targets. So you see these everywhere. Over the last several years, the Washington Group questions have evolved into a suite of question sets that cover more domains and can be used with different populations. And Rebecca will be talking with you about these different question sets later. But a word of caution on the Washington Group tools. They were developed to collect survey data on persons with disabilities, but they are not screening tools. They were not designed to identify disability from a diagnostic perspective. And so they should not be used as a replacement for medically based screening and identification tools that exist in country or that may be under development in country. And this is an important distinction for the work that we do in inclusive education, particularly at the pre-primary and primary levels, where we are often confronted with operating environments that do not have well-developed early identification and referral systems. So as we use them for our programming purposes, and these are the questions, this is the framework that we promote and that Rebecca will be talking about, we need to be using them from the perspective of collecting data that allows us to disaggregate activity, outputs and outcomes, but certainly not to diagnose disability. And it's important to keep this incremental approach in mind when things like referral systems and services don't exist. So collecting disability disaggregated data, it does allow us to still understand disability prevalence and encourage our programming to be responsive to the needs of learners with disabilities while working towards that longer term systemic change that we want to see. So now let me turn it over to Rebecca to talk with you about how to collect data on disability. Rebecca, over to you.
Great, thank you so much, Leah. All right, so as Leah said, I want to talk a little bit now about how to collect disability disaggregation data and talk about essentially the requirements that are written down in this how-to note that we released last year. Now, let me re-emphasize, as Leah just mentioned, that we're talking about collecting data to disaggregate activity outputs and outcomes by disability status. We're not talking about diagnosing any disabilities. We're talking about data that allows us to disaggregate our output and outcome data by disability status. Okay, so there are three sets of requirements in that how-to note for us to be aware of. The first is knowing which activities must disaggregate their outcome and output indicators by disability status. The second is knowing which indicators must be disaggregated. And the last is sampling considerations. But I want you to note that the requirements change depending on the age of the targeted individuals. So for learners who are under the age of 18, only activities that are targeting learners with disabilities must report disability disaggregated data. For activities targeting individuals over the age of 18, all activities must report disability disaggregated data. In terms of indicators, almost all of our individual level indicators, so almost all of our indicators that measure the individual learner require a disability disaggregation. There are a couple of exceptions because of the burden of data collection, but most of them require disability disaggregation. And in terms of sampling, activities should sample for disability status only if the activity targets learners with disabilities. And I want to talk a little bit about why these rules. So first, it's really important to understand why the requirements change depending on the age of the targeted learner. And the reason really is about the availability of validated tools that are feasible to implement. We'll talk about this in just a moment, but there are the tools available for learners who are 18 and over are easier to implement in the context of our USA programming than the tools that are currently available for learners under the age of 18. So we are not requiring all activities that target learners under the age of 18 to report disability disaggregation unless they're specifically targeting learners with disabilities. And we'll talk a little bit more about that in a moment. Next, the reason that we require disaggregation of almost all of our indicators that measure the individual learner is really because the education policy has this focus on access and learning outcomes. And disaggregating our individual level indicators by disability status allows us to understand if individuals with disabilities are accessing our programming, and what's happening with their learning outcomes. Is our programming serving them similarly to how it is serving individuals without disabilities? And then last, the reason for the requirements around sampling are that there are budget implications to specifically sampling for individuals with disabilities. And if your activity is not targeting individuals with disabilities, we don't require you to specifically sample for them, because that can really increase your evaluation budget quite quickly. However, if your activity is specifically focused on learners with disabilities, then we do require you to sample to make sure you have a high enough number of individuals with disabilities in your sample that you can draw conclusions from your data. Okay, now I want to talk a little bit about not requirements for collecting disability data. We've shared with you in the previous slide all of those requirements, but I want to talk to you about some best practices for collecting this data. And let me say that even though these are best practices and not requirements, the quality, usefulness of your data really depends on how well you follow these best practices. They are quite crucial to producing high quality, useful, productive data. And we've developed a brief resource outlining the best practices that we'll discuss today. You can see that best practices document linked into this slide, and we'll share the links in the chat box later in this presentation. So please take a look at this later on. It's short, really heavy on graphics, and really easy to read. And today I'm just going to be talking about a handful of the best practices. You'll find more in this document. So the first best practice is really selecting the right tool. And this slide is going to clarify a little bit of why the requirements change based on the age of the learner. So first, let me say that your first consideration is selecting a tool that aligns with the purpose and the age of your target participants. And you see here this decision tree, which is the basis for an interactive tool selection guide that we will share with you later on in this presentation, the link to. This decision tree will help you to select the right tool. So first, you must select the right purpose. And this goes back to what Leah was talking about at the beginning of our conversation today. Your purpose might be to individually identify or diagnose learners with disabilities. And if that's the case, you would follow the left side of the decision tree, the red. But let me reiterate what Leah mentioned, which is that if you are going to use an individual identification tool, which again is mostly used for diagnosis, then you must make sure that you have a path for delivering services to those individuals who are identified as having a disability. If you don't have that path, and if you really are just looking to disaggregate output and outcome data by disability status, then you really should follow the right side of the decision tree, which is the purpose of disaggregating data. And once you understand your purpose, and once you've decided which side of the decision tree you need to go down, then the next crucial question for determining which tool to select is the age of your target participants. So I want to talk now a little bit about the different tools available based on the different ages of learners in an activity. So different tools have been validated for different age groups with certain sets of respondents. So it's important to select a tool that has been validated for the age you're targeting, and also to make sure that you implement it with the right respondent. So for example, if your activity is targeting children and youth aged 5 to 17 years, there are a few tools available. And they all must be implemented with the child or youth's caregiver or teacher or trainer as a respondent. So you'll see that if the individuals you're targeting are 18 years and older, there are tools available that allow you to collect this data only by talking to the learner, him or herself. So you can just go in, ask their learner a short or longer set of questions, and they can self-report their disability status. For individuals under the age of 18 years, all of our current tools require either a caregiver or a teacher or instructor to respond on behalf of the learner. This makes collecting disability disaggregated data for younger individuals a lot harder because you can't just go to the learner, him or herself. And that is the reason for our changing the requirements based on age. We don't want to require activities that are not targeting learners with disabilities to collect all this data if that means they have to go out to the caregiver or to the teacher to ask the questions. But we do expect, again, that activities that are targeting individuals with disabilities will plan for and budget for this step of collecting this data from caregivers or teachers if it is not already available. All right, so of course our next consideration then is making sure we select the right respondent and interviewers for which the selected tool is validated. And not doing this can lead to inaccurate data. So in other words, using a tool that requires a caregiver to respond, but instead of implementing it directly with the learner can produce inaccurate data. So let me just explain some terms first. When we say respondent, we mean the individuals who provide the data, regardless of whom the data is about. So a respondent could be a teacher speaking about a learner, it could be a caregiver speaking about a learner, a child, a youth, or it could be the learner, him or herself, depending on what the tool requires. An interviewer is the individual who will collect the data. Sometimes the interviewer might be the same as the respondent. So the individual who collects the data is always someone who is trained to collect the data. It might be a trained interviewer who you hire for that specific purpose. It might be a teacher who has been trained to collect that data. So an example of this is one of the available tools from the Washington group is the Child Functioning Module, or the CFM. And that's validated for trained interviewers to implement with caregivers as respondents, even though the data is about the child or the learner. Okay, the next consideration is translating and adapting a tool. So once you select a tool, you still need to adapt and translate it for your particular context in the language of the individuals who are responding. So when you adapt, when you adapt, it's important to maintain the original meaning of the questions, but also assess the appropriateness and relevance of the questions for that context. And we really strongly recommend including a disabled persons organization in the process of adapting a tool. Next, once you've adapted the tool, then you translate it by, again, maintaining the original meaning of the questions and applying a consensus or a committee approach to translation. In the past, translation and back translation processes have been popular, where you first translate the tool into the language you're implementing it in, and then you translate it back to English, for example, to make sure that the translated version does maintain the original meaning of the questions. Now there are some newer approaches that are more promising, and these are consensus or committee approaches that require a group of people to translate it, review the translation together, and make revisions. These translations that take a consensus or a committee approach tend to produce more accurate translations. We again encourage including a disabled persons organization in this process to ensure that the language used is appropriate and does not add to stigma around individuals with disabilities. And we also encourage that the tools be translated into all languages likely to be encountered in data collection. And then finally, we recommend conducting something called cognitive interviewing to ensure that the adapted translator tool is understandable and understood as originally intended. Cognitive interviewing is a process of sitting down with someone who has a general profile of the respondent, the intended respondent on the tool, and walking through the tool with them and asking them how they are interpreting each of the questions and asking them to think aloud as they respond to the questions. It allows interviewers and the tool adapters to make sure the questions are being understood as intended. A next important consideration and best practice is providing accommodations to all of those who have disabilities in the process of collecting the data. And this does include including interviewers who have disabilities as well, and making sure that you provide accommodations for them along with the respondents who have disabilities. Accommodations may include sign language interpretation, Braille questionnaires, etc. And our final best practice is ethics. And at the heart of this list of do's and don'ts is the principle of do no harm, which is especially important, of course, when we're collecting and handling data on children and youth regarding a topic that could lead to stigma if not handled properly. So first, we request that you do not collect individual identification data or data that leads to a diagnosis if there is not a plan to provide referral services and accommodations. And this really is at the heart of why we recommend the social model functioning tools that really focus on disaggregating data and not individually diagnosing learners. When there is no plan or availability of services, focusing on disaggregating data allows us to understand the learners we're reaching and understand how well we're reaching them without providing a diagnosis without any follow-up. Next, of course, do ensure that data collection does no harm. And there are a bunch of things that you would do here to make sure that your data collection does no harm, including security of data, training of interviewers. Next, do share aggregated data, not individually identifiable data, but aggregated data with ministries of education and health so that they have the information about prevalence of disability in the schools where you're working as well. And do obtain consent and or assent before you collect the data. Consent is specifically for caregivers, teachers who are providing the data, and in cases where you're working with minors, for whom you've already obtained consent from a caregiver, you still would obtain their assent before delivering that tool. And then, of course, do satisfy IRB requirements, both local and global. So thank you so much for your attention to all the detail there. Again, these considerations and best practices can be found in our best practices document that we'll share with you later on in this, the link to which we'll share with you later on in this presentation. But now it's my huge pleasure to hand this back to Leah and some of our colleagues from two of our missions, from our Rwanda mission and our Nepal mission, to speak a little bit more about their experiences in disaggregating, collecting disability disaggregated data. Over to you, Leah.
Great, thank you. Thank you so much, Rebecca. And we've started receiving some really good questions. Keep those questions coming. We're going to have some time near the end for some discussion and Q&A. So let me now turn it over to our mission colleagues. We're going to start with Trifine from USAID Rwanda to talk with us about early grade reading and youth workforce development programming that's happening in Rwanda. And Trifine will share with us a little bit about the programming and really focus in on the data piece, talking about what, how the need for data arose, what type of data is being collected and how it is being used, and importantly, any challenges or lessons learned that would be of benefit to the larger group. So Trifine, over to you. If you'd like to come on camera, just to wave, I know you're having some bandwidth issues, so you can also conserve that bandwidth and stay off camera too if you'd like. But over to you, Trifine.
Thank you very much, Leah, and good morning, everyone. I will just turn on my camera briefly because I'm experiencing the bandwidth issue. So this is me, and I'm really happy to be talking to you today and sharing my experience. I'm Trifine Munganyinga. I'm the mission's Gender Equality and Disability Inclusion Advisor. Let's move on to the next slide, please. So I'll be talking about our mission programming in youth workforce development and also in the early grade reading program. Let me start first with the early grade reading program, which is Mureke Dusome. This is called Let's Read in English. So the program was for 5 years with 10.8 million, and it had really important objectives that included the improving the reading skills of Rwandan children and also enhancing local capacity. The target population are children from P1 to P3, both from the public and government-aided schools. And also we had the national geographic coverage. And in the last year of the implementation, we had to focus only on in 5 districts. I would say why. So briefly, this early grade reading program was implemented nationwide in order to support the reading skills for all children in Rwanda. And what we've learned was about if you don't really intentionally take into account the children's abilities or adults with abilities, you end up facing the issues of discrimination. You may discriminate without having an intention. If you don't really take time to think about your program, what are the beneficiaries and how to reach out to the beneficiaries, then you end up excluding. We learned through this program implementation, which was during 4 years, but during the 4 years, through the activity monitoring data, we ended up realizing that only 1% of children's abilities were participating in the reading community interventions. And the final year of the project that started last year and was ended this month, early this month, we felt like it would be good for the implementing partner to really dive deeper and assess the situation of children's abilities in the communities. Then implementing partner, who is Save the Children, was working in partnership with local DPOs. They did an assessment to understand the real issues in the community, to identify the children's abilities and understand really the magnitude of the issue. That's where we really understood that there is really a large number of children's abilities which are hidden in their families due to the stigma, due to the discrimination. And then from there, the implementing partner went back and conducted surveys with the parents, caregivers, and also teachers to understand the real constraints and challenges that these children were facing. So the final year of the activity was mainly focusing in addressing some of the issues these children were facing, and also came up with some indicators that would help really try to capture the progress and also address the challenges, including one intermediate result that was looking at equity and inclusion, and also some customer indicators that were looking into how these children are now participating, and also the behavior change in the community, looking at the parents and the caregivers. So we really learn throughout, and we were able to adapt and be flexible in terms of designing an intervention that is really dedicated to addressing the challenges. Coming back to the youth workforce development, this activity was also kind of designed last year, and it came about lessons learned through another youth program activity, because we realized that youth are mainly facing the issues of unemployment and also the lack of skills that are responding to the market needs. So from there, we got a funding opportunity from the DDI, and the mission was interested to really apply for the funds. And we encouraged our implementing partners and also the DPOs, the disabled persons organizations, to come together and come up with ideas on how we could really target youth and also come up with intervention that would help them build their skills, at the same time bridging the gaps in the community to really challenge the social norms, cultural beliefs, and also make sure that the private sector and the government are on board in terms of creating an enabling environment for youth. So this program is only for 2 years. It's a kind of like a pilot program, and objectives include the increase of employability for Rwandan youth, particularly youth with abilities. We are targeting almost 80% of youth with abilities in this program. And also we have another objective to enhance the enabling environment for youth with abilities, trying to tackle both the community environment and also the private sector environment, so the employment side and also the education side of this puzzle. We are targeting youth from 16 to 35 years old, and we have the geographic coverage in 12 districts of Rwanda. We actually feel like the data is really useful, because as an inclusive development, we need to use evidence-based data to plan and also to implement our interventions. And also, as we learn, as we monitor, we need to be embracing the adaptation. How do we adapt? How do we implement interventions that are tackling the real needs in the community, and also make sure that we are not exclusive? So briefly, we learn and we adapted, and also we continue using the lessons learned throughout the mission programming. For example, we currently have our CDCS for the next 5 years, and our CDCS was informed by all these learnings throughout our programming in education and in other sectors. And currently, the education programming include one activity that is dedicated to supporting children with disabilities. That will be like a standalone activity, and that is a good example that I could share here, that our learning throughout has been influencing our way of thinking, our way of planning, and also engaging with the external stakeholders, both the government and also the disabled persons organizations. Something else that I could mention is some of the challenges. Of course, we say always that there's no data on disability. Yes, that is true in some contexts, but we need internally, as we have said, to look for ways that our implementing partners understand the need to be inclusive, and also collect data as we implement, as we monitor our interventions. Some other issue is budget. So as I mentioned, if we don't really plan for disability inclusive right from the beginning, it's really difficult to plan for budget at a later stages. And even our implementing partners would always say, we don't have budget for this. But if we had planned for disability inclusion with a budget that would be dedicated to that kind of intervention, then the partners, as they submit the applications or proposals, that is taken into account as part of what they'll be implementing. And that should also be part of the implementation plans, and also the monitoring and evaluation and the learning plans. So we have these throughout the programming cycle. Some of other challenges also is the way of including or engaging with the DPOs, the disabled persons organizations. So we need to be intentional. We need to be deliberate. We need really to value these people's input because they are experts in their areas and they are smart people who could really contribute to our programming. So these are what I could share now, but I'm really happy to get any questions and we continue sharing information as we move on. Thank you.
Thank you so much, Trifine. That was a really rich presentation, and you managed to share so much in a short period of time. So thank you very much for that. There are several questions actually for you in the chat box. Some questions about the specific activities, and so if you're able to respond to some of those in the chat box, I think that would be great. One of the questions too that was posted in the chat earlier before you started presenting, but I was thinking about the work that the mission was supporting out there, is a question about how do you reach the many out-of-school hidden children and youth with disabilities? Are there any best practices? And it sounds like from your presentation and experience with the Let's Read activity that working with local disabled people's organizations is one way to reach that hidden population. So if you have any more thoughts about that during the Q&A, we would be really grateful to hear. Let's go ahead and pivot to Laura to hear about the experience in Nepal with Reading for All. So Laura, over to you.
Great, thanks so much. Can you hear me okay?
Yep, we can hear you great.
Okay, great. So for Reading for All, the overall objective is to improve early grade reading outcomes among children with disabilities. And there are 4 sub-objectives contributing to this that you can read on the slide, but I'm really going to hone in and focus on the data quality and the early screening with children with disabilities, because this has been a real challenging area for us, and it's still quite new, I think, in a lot of places. So here in this sub-objective, we're supporting a sub-EMIS system for screening and referrals. So the national EMIS system works pretty well here in Nepal, but students with disabilities are not usually captured in the EMIS system. So we're supporting early screening with teachers filling out the Washington group set of questions that was discussed earlier with the child functioning module for the students. And then that information is uploaded into the sub-EMIS system that we've developed with the Ministry of Education, along with other information such as if the student needs a referral to a medical provider or should sit at the front of the classroom, etc. So it's flagging them for potential functional limitations, which, as was mentioned earlier, the tool has not been validated for, which I'll discuss in a second. So let's see, so as we're trying to connect this sub-EMIS system, which we're piloting right now, we're also trying to connect it with the health management system and the social welfare system at the local level to kind of have a case file for a child, since these systems don't speak to each other at all. And this is really challenging because that's working with 3 different ministries, and now Nepal's kind of shifted to federalization, and so a lot of things are happening on the local level. Okay, so the target population is for our program is grade 1 through 3. However, early screening is being conducted in ECE, and the original award focused on 16 districts, which we've scaled down to 10 districts. So just in terms of where we are in project implementation, we're still in the beginning stages. So we had a 1-year delay due to the government that was kind of outside of our control. So we couldn't even do startup activities. And then the first year of actual in-school interventions was supposed to be last year when the pandemic hit. So in terms of where we are implementing right now, we're conducting early screening and hoping to do baseline of EGRES soon. So in terms of, lessons learned, let me just go to lessons learned since we're running out of time in the early screening tool itself. So before our program started, the government, UNICEF, and the implementing partners that we're working with recently completed an early detection pilot using the Washington set of questions, along with some mini assessments that was developed by the Ministry of Education and DPOs. And so there was no validation of this tool. So in our program, we decided to move forward with the Washington group set of questions since the government was comfortable with it, and they had used it before, and there was really no alternative because conducting vision and hearing tests in schools is not something that's feasible given the resource constraints. So it made sense to do some type of screening at the school level where students could be referred to get a proper vision and hearing or a formal diagnosis if they're flagged as having a potential functional limitation. So as many of you know, the child functioning model is not yet to be validated. It's only validated at the household level, usually by parents or the caregiver, as mentioned earlier. But because it's so difficult to get parents to come to the school to answer these questions for a number of reasons, primarily they have to work, our program looked at having teachers respond to the Washington Group set of questions based on their experience with the student. So at the beginning of the program, we bought into a PPL-based mechanism called RF-MERL to conduct research to validate the tool and see if there is a positive correlation between what the teachers found with students in terms of potential functional limitations and what vision and hearing medical experts found when they conducted the medical assessments. But because the program was delayed, we couldn't use that mechanism anymore. So our partner, Handicap International, conducted the research themselves. So their study stated that there's a 66% correlation. However, another analysis of the same data that they used shows only a 27% correlation. So this has a lot of implications and shows just how challenging it is to find and identify and use a tool. As was presented earlier, there's no validated tool that can be conducted at the school by teachers or instructors. So this is really challenging for our program. So right now we're moving forward with using the tool with only home visits and community visits with the child functioning module of the Washington Group set of questions asking parents or caregivers. So my recommendation in this area is, given the sensitivity around it, if there's not a validated tool, implement on a smaller scale and with a partner that has research capability. So again, we were going to, but we couldn't because of the program implementation timeline. So this is a definite challenge in the area. Another recommendation is to integrate, just at a programmatic level, integrate disability inclusive education into other programming. So Reading for All was kind of built on top of EGRP, our flagship early grade reading program. And so we decided to implement in the same 16 districts that EGRP was implementing in. But the two programs had little incentive to work together because they had different implementing partners, et cetera. And I think even internally in our office, it was a bit hard to coordinate as well. So in our next iteration of programming and activity design, we're looking at integrating disability inclusive education with our flagship early grade learning program. So let's see, other lessons learned. We prioritize partnering with DPOs as sub-partners and implementers in each district. However, they lacked the administrative, financial, and technical capacity on early grade learning for children with disabilities because they have a lot of strength in their advocacy work. So that's an area that our partners had to build up with them a lot. So that's been a challenge. And then of course, conversations with the government and DPOs around screening and disabilities are complicated. So, well, for example, I would prefer to drop maybe some of the domains in the child functioning module, since anxiety and depression, because I think those are hard to validate. If teachers are the respondent, DPOs argue to keep those categories in the module. And so it's just, these are challenging topics with a lot of sensitivity. I think in terms of opportunities, there's more interest in funding in this space from other donors and INGOs. So there's lots of opportunity to coordinate with others to strengthen the sector. I think that's it for now. Thank you.
Great, Laura, thank you. And Trifine, thank you so much. So now we just want to give you all the opportunity in the chat, because we're running out of time, to just share any challenges and opportunities that you've encountered in disability measurement. So today we've heard challenges related to coordination, related to the availability of tools or the feasibility of tools. If there are any other challenges that you've experienced in collecting disability disaggregated data, we would welcome you to write those in the chat as we continue with the presentation. And throughout the presentation, Emma has shared links to these 3 resources that we have that are available to you: our how-to note, our best practices document, and our disability identification tool selection guide. So those are there for your use and your partner's use. And we just, before we turn to Q&A, we just want to share some of our next steps and a call to action for you all. So based on the challenges you've heard today about the availability and feasibility of tools, we in the Center for Education and the DDI ID Hub are supporting a pilot of a tool that can be implemented with teachers as the respondents, so that our activities can collect data at the school level. And we're also potentially working on a validation of the Washington group short set with youth under the age of 18, so that we can capture that perhaps 15 to 17-year-old range and directly get their data. We request that you support disability measurement in your activities and ensure that it is aligned with best practices. We ask that you incentivize your partners to budget funds for this purpose in their proposals. And we ask that you engage governments and partners in this effort, and engage with us in planning and implementing small validation pilots through your existing and forthcoming programming. So now we want to open it up to some Q&A, and I'll hand it, we only have a few minutes left, so I'll hand it back to Leah.
Thanks, Rebecca. Thanks, everybody, for all of the questions and for everything that people are sharing in the chat box. I want to invite, if there's anybody who wants to come off mute and ask a question or make a comment. A lot of the question, you can go ahead and use the raise hand function if you'd like to do that. I think several of the questions have been answered in the chat box. A couple of the questions that were raised asking what is the role of the local Ministry of Education working with and collecting disability data. I think we got a lot of good examples from Trifine and Laura's presentations, working with ministries on their education management information systems and those sorts of things. The question about how do you reach the many out-of-school hidden children and youth with disabilities, that's a real challenge. We know that there's a large population of school-age children and youth with disabilities who aren't in school or education settings. Working with local disabled people's organizations is one way to reach those populations. They know, to some extent, where people with disabilities are living in their communities and can help to identify those individuals that way. Does anybody want to come off mute though to ask a question or make a comment? I want to allow the space for that if anybody is feeling inclined, and that's okay if you're not. We have a lot of great comments coming into the chat boxes, Teresa sharing challenges and Catherine sharing challenges too that you've observed. Doing these kinds of presentations where we bring mission staff together, it always, for me, it underscores really the usefulness in bringing people together. I think that there's a lot of programming, as we saw, 60 activities, inclusive education activities in fiscal year 2020. Let me just say that we'll soon be putting out a briefer that provides more information about those 60 activities that cut across primary and youth workforce development and higher education. And so my hope in that resource is that colleagues in Washington and in the field will be able to connect with each other and share more information about the programs. I think we're just here at time. There's 2 final polls that are available. We would love to hear from you if there are further conversations that we could help to facilitate, to exchange information and to learn on the work that is being done to collect data on disability in the field. We're happy to facilitate those types of exchanges. Please also, you can forward to the next slide, please also feel free to reach out to Rebecca or myself. Our emails are listed on the last slide with any questions that you have. Yes, Trifine, please.
I just have one quick kind of recommendation or lessons learned, which is to really plan for engaging the disabled persons organizations, because as development practitioners, we don't have to claim to be experts in every single area, especially that these people with abilities are being discriminated for centuries, and the common kind of understanding or the excuse from people is that we don't know what to do, we don't know how to do it. So let's really be intentional and engage with these organizations because they know better, what should be done. They know their challenges, they know how to address them. So I would really encourage everyone here to really, in the next maybe few months, or as we plan to engage these organizations, really have an active ear to listen to them and take into account some of the recommendations from them and see how to budget for that, so we make things change. We contribute to the change you want to see in 5 or 10 years to come. Thank you.
Beautifully said. I couldn't have said it better. I think that's a great point to end on. So thank you, everybody, for your participation today, and we look forward to keeping in touch. Thank you. Bye.